Good afternoon, everybody. I'm Yasmin Vasugian. It's 11 a.m. out west and 2 p.m. in Washington, where the House of Representatives cannot act soon enough. Here's the latest. There are more than 75,000 confirmed cases of COVID-19 in the United States. More than 1,000 Americans have died so far. And as the health crisis grows, we're actually getting our first true look at the economic toll of this virus. A staggering 3.3 million Americans applying for unemployment benefits last week. That is more than double the estimate and nearly 5 times more than the previous record set back in the 80s. Some economists are now predicting if current patterns do hold, that unemployment could surpass that seen during the 2009 recession. The Senate passed its, quote, phase 3 stimulus bill last night. It includes a temporary expansion of unemployment benefits and direct payments to Americans making less than $99,000 a year. President Trump has indicated he will sign the proposal, but first it needs to pass in the House, which is currently still in recess. Now, Speaker Nancy Pelosi confident about the bill's future, even as she conceded it's not going to be able to pass with unanimous consent. Watch this.
Tomorrow we'll bring the bill to the floor. It will pass. It will pass with a strong bipartisan support. Our members want to come back in order to have the debate, and we expect to have a voice vote on it one way or another, with losing no time with the UC or anything else. We will be passing the bill tomorrow.
So the earliest that we are expecting the House to take any action is tomorrow, as you just heard from the Speaker, but with mortgage payments and rent due in less than a week. The big question here is that too late? Joining me now from Capitol Hill, MSNBC correspondent Garrett Haake for us. Garrett, my friend, good afternoon to you. Thanks for joining us on this. I think the question on so many Americans' minds is, when are we going to see the results of this, the benefits from this bill?
Yeah, look, even if the House had passed this yesterday, it'll still be a couple of weeks before anybody's able to see those direct payments or the plussed up unemployment benefits that are promised in this bill. The best estimate is it'll take 3 weeks for the direct payments to come out. And that's only for folks who use direct deposit when you file your tax returns. That's kind of the mechanism by which all of this is being done. If you get a check from the government for your tax returns, this could take even a little bit longer. So we do expect to see the House act very quickly tomorrow. The president's given every indication he'll sign this bill right away. But just the sheer scale of what we're talking about here in terms of disbursement of money is going to take a little bit of time.
Hey, Garrett, just quickly here, with regards to gig workers and freelance workers, I have a lot of those people asking me that question as to whether or not they're going to be able to apply for unemployment benefits. Any news on that front?
They will. This is a change in how unemployment benefits are considered and calculated. Gig workers, if you're an Uber driver, for example, you will be able to apply for unemployment benefits. They're using a formula that's based on how things are normally handled during major disasters like hurricanes. Well, this is a major disaster, too, just on a very different scale. So people will be able to apply for unemployment benefits, including that additional $600 a week that might not have otherwise been available to them. Although it's my understanding, just from hearing anecdotal reports from around the country, folks trying to apply for unemployment benefits even now are finding jammed phone lines. The entire process is just backed up, given how sharply and how quickly this economic portion of this disaster has hit all around the country all at once.
Yeah, that's the other big question, right? Amidst all the questions that we have is there a system in place to basically manage the magnitude of people that are going to be applying for unemployment benefits and small business loans? Garrett Haake, my friend, stay healthy. Thank you so much. Joining me now,
Thanks,
MSNBC host and business correspondent David Gura, and Neil Barofsky, who about a decade ago, as Inspector General for TARP, oversaw what was until now the largest stimulus bill in American history. Neil's also the author of Bailout. David, I'm going to start with you on this one. Staggering numbers today, to say the least. 3.28 million jobless claims versus the 1.5 million that were originally expected. What does this mean for the economy at large, seeing these numbers come out today?
Yes, I was trying to think of an analogy as I looked at the chart this morning of those weekly jobless claims. It's like being in Yosemite and you see El Capitan right in front of you there, that immediate precipitous leap to this level that we've seen, a record that we haven't seen before. It is a shocking number, 3 million plus applications for those unemployment benefits. And really what's significant about it is how much worse things are already than a lot of people thought. Yes, it's a record number, but these are early days yet, as you know. And anecdotally, we've been hearing about the crunch that you were just talking about with Garrett Haake. at the state level of folks applying for these benefits, the level of anxiety about unemployment that exists in this country, to see that many people this early on filing for those benefits is really astounding. And again, I think it portends where we're headed here. So many economists looking at the state of the economy right now and this public health crisis and really wrestling with something that is unprecedented, the scale, the magnitude of it. This is yet another variable, another part of that calculus that shows us how bad this is likely to be, Yasmin.
Neil, let's talk a little bit about history here and then what's happening today, surpassing your $700 billion TARP program, which subsequently ended up being a little bit less than that. But nonetheless, what is the timeline here, right? A lot of Americans are asking, what is the timeline here and how much red tape is there in the way of Americans seeing results?
Well, we're going to have to wait and see a little bit. I mean, one of the remarkable things about this bill is it pushes so much responsibility out of the hands of Congress and into the Treasury Department and the Federal Reserve, as well as the SBA. So for this money that's going to be distributed to businesses, there's different tracks depending on which program it is. But these agencies are going to have about 5 to 10 days, depending on what it is, to put out regulations or procedures for applications. Then companies are going to have to apply, get approved, and only then will the money be dispersed. So we're not talking about an immediate injection, and so much of it is going to depend on how much these agencies can get their act together, push these rules out, and then execute on approving applications and getting money where it's so desperately needed.
So I don't want to put you on the spot here, but you have been through something like this in some respect. I think a lot of Americans are asking this question as to how long that is. You're saying not necessarily immediate, but what does that look like? Does that look like 1 month? Does that look like 2 months? Because a lot of people need to get paid. A lot of people need to pay their bills. Who is going to be responsible for making sure that no Americans get overlooked in this process? As I was just talking to Garrett about, a lot of these systems are going to be inundated with people applying for small business loans and for unemployment benefits, and how long it's going to take for them to actually see the results really here is the question.
Yeah, I mean, look, you're basically depending on the efficiency of government, and sometimes that works really well, and sometimes it takes really long. But the SBA, for example, which is going to be overseeing $350 billion of money, which will be dispersed through applications to the banks that make SBA loans, but they've never seen anything like this type of volume. So they need to get the rules. The banks themselves are going to be really important, because that's for the SBA program, that money's coming through the actual banks themselves. How quickly can they staff up and process this enormous amount of loans and get the money out? And on the other side, you have the Federal Reserve making decisions and Treasury on countless. I mean, there's almost no comparison to TARP, because remember, in TARP, we're talking about banks for the most part.
Right.
There's only so many banks. They were well regulated. You can assess an application relatively quickly because you already had the constant review that bank regulators do. This is a whole new ballgame, and we don't know the rules yet. I think that's part of the problem here, is we don't yet know all the rules.
So let me ask you, working in government, do you think they're ready for this?
It's going to be a climb. I mean, it's going to be a climb.
But in all honesty, I mean, just so people, because I think it's important that people understand their expectations going into this, right? Because a lot of people are nervous, anxious, and frustrated. So, in all honesty, from your point of view, do you feel like the government is ready here, or is this going to be another hill to climb for quite some time until they see results?
So the reason why I'm being a little cagey is that we've seen it both ways, right? When it's really, really important for the government to get money out, they did with the big banks in 2008. They got that money out in a heartbeat, okay? So when properly motivated, they can do it really, really quickly. On other things, with the housing program from the last time, if you remember, it took a really long time. It was less of a priority. They had more concerns about who was receiving the money, and it took a while. So I think it's impossible to pick a date or a time, but I will say, if you're applying for some of these funds in any of these programs, I would get your application in early, because first in is going to probably be first out.
The earlier, the better. David Gura, Neil Barofsky, thank you guys both. Appreciate it. Joining me now from Arkansas, Republican Congressman French Hill. Congressman, thanks so much for joining us on this. I actually first want to start with Speaker Pelosi and the sound that I played a little bit earlier, basically saying that she expects the stimulus bill will pass tomorrow, not necessarily with a total consensus here, though. Do you agree with that?
I do agree with that. Thanks for having me today. I think we'll have 2 hours of debate in the morning and then a vote around midday, and I do expect it to pass.
Do we need another bill at this point? I mean, we have phase 1, phase 2, phase 3, but it seems like Americans may not have enough at this point considering the timeline of this thing. If it goes into summer, if it goes into fall, I don't think anybody really knows. I don't even think the scientists and doctors know at this point, but is there going to be a phase 4? Is there a plan for that?
I think it's a great question. I think we ought to look at the benefits that we have in unemployment, in child health care, in food, in benefits to our health institutions, our education institutions, and the small business and business lending program that you just discussed. Those are in place for a number of weeks, through June at least. So I would say let's see how the health crisis progresses or stalls, and let's see what businesses' response is, exactly the questions you were talking to Neil about.
So let me ask you that question, Congressman, that I did pose, Neil, and that question is really, is the government ready to be inundated with all of these small business loan applications along with unemployment? We've already seen evidence over the last couple of weeks that they were not necessarily ready for the increase in unemployment claims, hearing of websites toppling, not working, people having to call in multiple times.
Right. So the unemployment insurance process is through the states. So some states will be ready, but those who have a high concentration of layoffs all in 1 week obviously are going to be under stress. As it relates to the small business lending, I think the best thing about that is it's going to be distributed through the commercial banks. So we'll have 5,000 banks that'll be delegated to use SBA guarantees by the Treasury. And I hope that information and those instructions will be out by next Friday, and that money can start flowing just as quickly as possible. So it is easier by going through the existing banking system for a majority of those businesses needing badly needed liquidity.
Congressman, I want to ask you this question while I have you. Should your state issue a shelter-in-place order at this point? The governor pushed back against that notion just a couple of days ago.
Yeah, thanks for the question. Governor Asa Hutchinson, I think, has done a good job consulting with our health professionals. We're in a rural state, and we've had more intensive business closures and restaurant closures in our urban areas of northwest Arkansas and central Arkansas. So I think our governor's taking it 1 week at a time, consulting with our health professionals.
All right, Congressman French Hill, thank you so much. Appreciate your time this afternoon.
Stay healthy.
Want to listen now to New Jersey Governor Phil Murphy talking about the increase in cases there.
To your presentation. We got a real, not unexpected, but we got a real gut punch this morning as a nation and as a state with a release of the federal unemployment numbers. More than 3.3 million Americans filing for unemployment benefits last week. In New Jersey, 155,000 workers filed for unemployment. That's 16 times the number that filed the week before. This makes federal assistance to backstop our state unemployment system even more critical. It's also a reason why I signed legislation yesterday to expand our temporary disability insurance and family leave insurance programs to provide more workers with access to paid leave benefits during public health emergencies. I thank Senate President Steve Sweeney and Assemblywoman Shavonda Sumter and their colleagues for leading this change. And as it also pertains to federal support, we are continuing to move aggressively to build out our hospital capacity as we outlined yesterday. And to that, I have continued my push with the federal government for the supplies that we will need from the National Strategic Stockpile. And these are the so-called personal protective equipment. And we reiterated our ask, and I'll give you a couple of data points of what's on that list. 4.5 million N95 masks and 2,500 ventilators, and frankly, everything in between: masks, gowns, gloves, etc. Regarding PPE, we have created an online form through which businesses and non-hospital healthcare facilities in possession of PPE, not required for the provision of critical healthcare services, whereby that form you can submit information about their inventory. Per Executive Order 109, which I signed on Monday, this information must be submitted by 5 p.m. tomorrow. That form is available at covid19.nj.gov/PPE report. Again, covid19.nj.gov/PPE report. And I want to give Colonel Callahan a big shout out here. For anyone who has PPE they wish to donate, they can reach out to us at covid19.nj.gov PPE donation/PPE donations. That's again covid19.nj.gov. That's the basic.
I want to reiterate there, listening to New Jersey Governor Phil Murphy talking about the increase in numbers with regards to the coronavirus COVID-19. 2,492 additional positives in that state just in the last 24 hours, showing how much these states need help right now from the federal government. Welcome back. A doctor described what's happening in New York City's hospitals with two bleak words. It is apocalyptic. At Elmhurst Hospital in Queens, 13 people died from COVID-19 in a single day. Elmhurst ER Dr. Colleen Smith gave a stark account of what she has witnessed to the New York Times. Watch this.
All the patients in this room, all the feet that you see, they all have COVID.
The frustrating thing about all of this is it really just feels like it's too little too late. Like we knew it was coming.
Today is kind of getting worse and worse. We had to get a refrigerated truck to store the bodies of patients who are dying. We are right now scrambling to try to get a few additional ventilators or even CPAP machines. If we could get CPAP machines, we could free up ventilators for patients who need them.
You know, we now have these 5 vents. We probably, unless people die, I suspect we'll be back to needing to beg for ventilators again in another day or two. There's a mythical 100 vents out there, which we haven't seen. Leaders in various offices, from the president to the head of health and hospitals, saying things like, we're going to be fine, everything's fine. And from our perspective, everything is not fine. I don't have the support that I need and even just the materials that I need physically to take care of my patients. And it's America, and we're supposed to be a first world country.
If anybody has any questions as to what is actually going on in this country right now with regards to the coronavirus and how hospitals are maxed out, they need to watch that piece. So a doctor at Brooklyn Medical Center said they are in disaster mode and that she and her team, they just pray and they try not to get paralyzed by fear. Imagine that feeling. So with supplies of protective equipment running low, nurses at Manhattan's Mount Sinai West have resorted to shielding themselves against the virus with trash bags. That same hospital lost one of their own, nurse Caius Jordan Kelly, only in his 40s. He died after treating patients infected with COVID-19. Joining me now, NBC News correspondent Ron Allen, who is outside of Elmhurst Hospital in Queens, and the New York Times reporter covering the situation in Elmhurst, Michael Rothfeld. Michael, I'm going to start with you on this one. You are reporting about the situation inside of Elmhurst, and you go on to write this. Calls over a loudspeaker of Team 700, the code for when a patient is on the verge of death, comes several times a shift. Some have died inside emergency rooms while waiting for a bed. You also describe a moment in which doctors are helping one individual patient while another individual patient is found dead in their room. What are these people telling you about what they're seeing inside of the hospital?
They're describing being completely overwhelmed by what they're experiencing with so many patients coming in at the same time, and they just can't handle the workload. People are too sick, and essentially it's just beyond what the system is built to handle.
What is behind, from what you're finding in your reporting, Michael, what is behind the number of deaths here? Patients waiting to go to the hospital and coming in sicker? What is actually happening here? Because you describe a scenario in the piece that you laid out in the New York Times where an individual tried to get testing on Monday, was refused testing, went home, got even sicker, came back Tuesday, was waiting hours and hours and still no test, still not necessarily knowing what's going on with them.
Well, Queens in particular does not have a lot of hospitals, and it's one of the hardest hit boroughs. They had 32% of the confirmed coronavirus cases. So Elmhurst serves a low-income population. So many people are coming to the hospital, so the emergency room is just filled up, and the waiting room is filled. And so they set up these tents outside, and it kind of relieves the pressure for people to go to these tents to try to get tested. But it's just so many people. The whole idea of flattening the curve is so we can spread it out. Right now, there's so many sick people. Some of them who went home and waited it out have become more sick, and so they're now coming in and they're getting even sicker within a matter of days and hours. And it's all the doctors and nurses can do to try to handle it with the limited, just like at other hospitals all across the city, as you described. It's just, it's overwhelming, the system that we have right now, the number of people who are sick.
Well, and you bring up in your piece, Michael, here, that it's not just public hospitals. A lot of people could look at this and say, oh, well, Elmhurst Hospital is a public hospital in Queens. Maybe they don't necessarily have the resources that other private hospitals have throughout New York City, but you're not just seeing this at public hospitals here.
No, it's not the fault of the hospital. It's the pandemic that we have. It's just the sheer volume of people that are sick is just beyond. I mean, one doctor said it's just beyond our worst nightmare. It's nothing that they anticipated or that any of us really anticipated. It's the sheer numbers, and so they're doing all they can. They're doing all they can with the number of ventilators that they have, and they're just trying to keep, as Dr. Smith said in the video, nobody's coming off a ventilator unless somebody dies. Then they get another ventilator, or if another hospital will lend them some ventilators, they'll do that. But it's not about public hospital versus private hospital. All hospitals right now are under extreme strain.
And as you mentioned, they are getting shipments of ventilators in, but it's not enough. Maybe they're getting 3, 4, 5 extra ventilators. That's just not enough to handle the amount of people that are getting to the hospital. So with that, Ron, I want to turn with you. Thank you for being patient for us. I know that you're outside of Elmhurst Hospital now. What have you been seeing so far today there?
Well, we've been seeing a constant flow and arrival of emergency vehicles. There's not one at the moment, but here at the ER, we've seen ambulances come and go just constantly for the time that we've been out here since early this morning. We also saw a long line for testing that wrapped around this area that they've got set up for it. There's no one there now. They put up a sign saying that there are no more tests happening today. Wow. We don't quite know why, whether it's that they've run out of tests or they've run out of capacity. We've not gotten a lot of answers from the hospital. That's what we've been seeing all day. We've been hearing that this is the only place they have to go. And I think there is something of an economic variable in all this. This is a diverse immigrant, low-income area of the city. Queens, as like my colleague pointed out, does have the largest number of cases in the 5 boroughs of Manhattan, of New York. New York has half the cases in the country, half the new cases in the country. I mean, it's just a staggering amount of numbers. One thing that the local leaders here are wanting is for one of these temporary hospitals that we've heard so much talk about. They want it to be built somewhere nearby here. It's one thing to build them over at the convention center. It's another thing to build them on campuses, college campuses up in the suburbs. They want something to happen here on the ground, very close by. Because the plan is to transfer patients out of this hospital, which, by the way, is at 125% of capacity as we understand it.
Wow.
The plan is to transfer non-COVID patients out of here, and this will become a completely 100% COVID-19 treatment hospital center in the days to come. But again, the local leaders want to see some more infrastructure built here, not just across town, to serve this community as well.
And I just want to talk about some new numbers that we're getting in before I let you guys go. We have a senior FDNY official basically telling NBC News that 131 members of the FDNY have now tested positive for COVID-19. It is penetrating every part of this city and going beyond the borders of New York as well. Ron Allen, Michael Rothfeld, thank you both for your reporting. Very much appreciate it. Stay healthy, my friends. There are 21 statewide stay-at-home orders across the country, but a lot of southern states are notably not on that list. Instead, cities and towns have chosen to act on their own. But in Mississippi, the governor issued an order to override laws made by local officials in response to the crisis. The order classifies most businesses as essential allowing them to stay open, even as cases of coronavirus in that state are rising. Joining me now, the mayor of Tupelo, Mississippi, Jason Shelton, and the director of Columbia University's National Center for Disaster Preparedness, Dr. Erwin Redlener. Mayor Shelton, thanks for joining us. I'm going to start with you first. On Saturday, you ordered some of the strictest safety measures in your state. You have now had to walk them back after the governor's executive order. Notably, Reeves's executive order supersedes any orders by local mayors, governing body in Mississippi that conflict with the businesses and or he deems exempt as essential businesses. So what do you make of these new regulations here?
Well, in Tupelo, we declared an emergency February 24th. This is something that we've known is coming. It's, a global pandemic. We've tried to be proactive here. We have a large medical community in Tupelo. We're listening to our doctors. We're listening to our scientists. We're following the CDC and Mississippi Department of Health guidelines. We've all got to flatten the curve. That's what we've been trying to do. The governor superseded that expressly, directly in executive order. So what we have to do is, we can't go further than that pursuant to the express language. So what we're trying to do is see what we can do to continue our efforts to keep people from getting sick in Tupelo.
So let's talk about that, what you can do. What are you doing to keep your citizens safe in Tupelo? If you talk to many experts, they say a lot of the country was behind the numbers. When you were seeing cases pop up, you should have started shutting things down then. So is there any way at this point that you can appeal to the governor and say, if we don't get ahead of this now, the cases are going to continue to rise and then it's going to get out of control?
Yeah, well, I had a conversation with the governor on the phone this morning, very cordial, very professional, but I expressed the concerns. They're twofold. One, if we're going to flatten the curve, we have to listen to our doctors. We have to listen to our scientists. And the second is there's very little, the governor's order, but there's not statewide uniform action. So in Mississippi, it's being left to the cities and counties to take action. In every one of them, we're doing something different. So if Tupelo closes non-essential businesses, it's sending people by car to neighboring cities, which is exacerbating the problem. It's creating more travel, more personal interaction, rather than the social distancing to flatten the curve. So, we need consistent, uniform action from federal and state level. What we've seen is that the goalposts keep moving. You'll have, from the national level to the state level, follow these recommendations, do these things, then you'll see an order come that doesn't say that. So businesses, individuals keep having to, follow changing rules. The goalposts keep changing. So we need consistent from the top down leadership. And, it's an emergency. We have to treat it like an emergency. If we're going to flatten the curve, if we're going to save lives, we have to take decisive, immediate action that is uniform across our state and across our nation.
Dr. Redlener, talking about some of these southern states, Mississippi pointedly as well, they have a lot of cases already. 377 cases in Mississippi, 5 deaths. I could go on. Louisiana, 1,795 cases, 65 deaths. Florida, 1,977 cases, already behind, really, when they should already have shut things down in those states as they have here in New York City. And you see in New York how the cases have progressed so rapidly just from last week, even day to day. So what do you make here, Dr. Redlener, of the governor's orders?
So, Yasmin, so there's a couple of points to make here. First of all, I just want to congratulate the mayor of Tupelo and the other mayors and city officials around the state of Mississippi for trying to do the right thing here. And so that's number one. And I really congratulate you and thank you for what you've been doing. Secondly, we are all suffering. The entire country is suffering from a lack of consistent message that has actually started at the top. And we've seen this for weeks and weeks where the president would say, everything's under control. And 5 seconds later, the head of the CDC or one of the other public health organizations saying, no, that's not quite right. And I'll tell you this, there's exactly one thing that we can do right now because we don't have a medicine that specifically can treat this virus. And secondly, we certainly don't have a vaccine. We're not going to have it for a long time. So the only action we have to do to save lives and to stop the spread of this disease and, flatten the curve as we're talking about, which means really just reducing the spread. The only tool in our toolbox are these very strict ideas that come from public health professionals based on science and modeling that say everybody needs to stay inside. We actually need a national, non-overridable ruling from the federal government says the entire country, if that's even possible, should be on shutdown, and the governors, each one of them, need to implement that. The fact that the governor of Mississippi is in a confrontation now with science and public health practices, and in a confrontation is going to cost lives. We can almost guarantee that people in Mississippi will die because of whatever's prompting or promoting this idea that the governor's been spreading, that somehow he should override appropriate public health practices. It's staggering. I don't think we've ever seen anything like this before. And I think that hoping the mayors of Mississippi will continue to push this. Do they have to go to the courts? What else and where else can they appeal this? But lives are at stake. I can't say that strongly enough. And I think we need to find a way to get the governor to change his mind, either voluntarily or in some way being forced to by the courts or whatever we have to do.
And actually, New York's Governor Cuomo said in spite of the numbers rising here in New York City, the guidelines, the social distancing, the shelter in place is actually working because we're not hitting those worst case scenario numbers in the hospital, despite the fact that the hospitals are being overrun. We're not at the point in which they thought we would be worst case scenario if there were no guidelines in place. So important points to be made there. Mayor Jason Shelton and Dr. Irwin Redlener, thank you to you both. Welcome back. The Navy is deploying 2 support ships to help hospitals overwhelmed by coronavirus patients. The USNS Mercy is on its way to Los Angeles, and the USNS Comfort is preparing to leave for New York City, the epicenter of the nation's coronavirus crisis. Join me now from Norfolk, Virginia, NBC News national security and Pentagon correspondent Courtney Kube. Courtney, good afternoon to you. Thanks for joining us on this. Let's talk first about the USNS expected to arrive in New York City. What is the plan here with regards to the dire help that hospital needs now?
So we know now, just in the last couple of hours, Yasmin, that this ship behind me, the USNS Comfort, is going to deploy out of Norfolk in about the next day or two, and it will be in New York City and seeing patients early next week. We heard that just today. This ship is really a floating hospital, as you know, Yaz. There's about 1,000 beds on it and about 1,200 medical personnel. Most of them are uniformed Navy. When it gets into New York City, it's going to be taking some of the excess patients, the surplus patients that the New York hospitals are so overwhelmed by right now. We've been hearing all day today about how the New York medical system is really overloaded. Well, now this hospital will be able to take over the trauma patients, the day-to-day cases that the hospitals just cannot handle. What will happen is the hospitals will take the people in and then they'll transfer them to this ship. There may be some concern. They will not be seeing any kind of coronavirus patients. One thing we've been asking here is how will they mitigate the potential for spread of coronavirus on this ship? It's very tight quarters. There's not a lot of opportunity for isolation. The hospitals in New York will test the patients, make sure that they're clear before they come on board the ship to ensure that those medical professionals aren't exposed to any of the virus, Yasmin.
All right, Courtney Kube, stay healthy, my friend. Thank you. So as we've been talking about, hospitals have tried to stay ahead of the predicted surge of patients. 3 weeks ago, NBC News went to Massachusetts General Hospital to see their stockpile. The hospital hoped that this warehouse that you're seeing here, full of gloves, gowns, and masks, would see them through the worst of the pandemic. You would expect it would, right? But Mass General has already tapped into that supply. According to their chief of emergency preparedness, it is the worst case scenario. They're already there. Joining me now from Boston, the vice chair for emergency preparedness at Mass General, Dr. Paul Bittinger. Dr. Bittinger, thanks so much for joining us on this. Appreciate it. Talk us through this, because our understanding was that you had this massive stockpile. You were ready for something like this, but you are now at a moment that you're tapping into some of these supplies that you thought could feasibly get you through this difficult time.
Sure. Well, certainly a lot of the reason that we have this stockpile is because we think we might need to use it. We have been working on this for more than a decade. It has exactly what you said, the gowns, gloves, respirators, masks that we need. The challenge is that we still think we're several weeks away from the potential peak of this outbreak, and therefore tapping into it a little bit early is of a challenge to us. So this is one of the weapons that we have. We have been working so hard with all of our supply chain leaders to make sure we've identified any other possible source for masks, for respirators, for gloves. But ultimately, the top priority is keeping our workforce safe. And so if we have to dip in now to make sure that we have the resources to keep our workforce safe, that's what we're going to have to do.
How long, Doctor, do you think that stockpile can last you at this point?
So the way we've modeled it is that if we had a complete shutoff of all of our supply chains, we think it's about 2 weeks. I'm really glad to say that that's not where we are. We have a lot of effort going on in our supply chain, and we are working with suppliers so that we think we will get through. I will say we think that we can sustain our stockpile, but we are using everything extremely closely. We've actually enacted extended use, reuse protocols for our personal protective equipment supplies, just like so many hospitals, so many systems around the country. That's what's necessary to get us through, in addition to using this stockpile.
Is it out of the ordinary to have a stockpile like you guys have at Mass General? Do other hospitals have the same type of storage facilities?
I know that some do, certainly the bigger systems, bigger hospitals, but I do acknowledge that especially for smaller facilities, this is really, really hard to do. It's one of the principles of modern business practice is that a big warehouse, a big inventory is costly and loses you money. So it's not common. Not everybody has it. It's what we've thought was prudent all along. And of course, unfortunately, in these terrible times, we're glad that we have it.
So I want to get to this last question before I let you go. As we have been reporting, a lot of healthcare workers are now contracting this virus. You have at least 41 staffers from your hospital that have contracted COVID-19. How has that changed the plan, and also how are they doing?
So we're really happy to report that the majority of our workers who we know have contracted the illness are doing well. We're doing very careful case analysis to figure out where they got it. And so far, with the vast majority of workers who we believe have contracted the virus, they've done so in the community as opposed to at work. And so, again, it's extremely important that we provide a safe work environment for our staff. But we look into every one of the cases to try and see if there's an issue there. We, in fact, have changed our personal protective equipment policies. One of the things that's been so surprising about this outbreak is how much asymptomatic transmission there is.
Right.
People who feel completely well have the virus. So we're using our masks. We'll protect our workforce, and we will get through this.
Dr. Paul Bittinger, you are a voice of calm amidst all of this, and I appreciate that. Thank you. I think our viewers appreciate that as well. Coming up next, Sky News takes us inside the epicenter of Italy's outbreak. We'll be right back. Welcome back. The death toll from coronavirus is now approaching 21,000 globally. Countries around the world are putting restrictions in place to stop its spread. Russia saw a surge in coronavirus cases this week. Today, officials announcing they're grounding all international flights starting tomorrow. Thailand has shut down its airports, stranding travelers. And they're banning all foreigners through the end of April. And then a massive lockdown is now in place in South Africa. Doctors and nurses there are conducting roadside health checks as well. The situation in Italy also remaining very serious, but there are early signs that the virus may be slowing. The daily number of deaths fell for the first time this week. But in the hard-hit town of Bergamo, the sound of sirens remains ever present. Here's Sky News Chief Correspondent Stuart Ramsey.
It never stops. They're telling people to stay indoors. This is what a total lockdown looks like in the center of the coronavirus epidemic in Italy. This is Bergamo, the dead center. It's quite scary. You don't really get used to it. It is apocalyptic, and of course here they're calling it the apocalypse. It doesn't feel that life here will ever be the same again. In the total lockdown, volunteers take food and supplies to the most vulnerable, the old and the already sick. They also take medicine to those who would simply die if they were infected. Valentino Trivia lost his uncle to the virus this week. Like so many, he wants to help. Like so many, he's broken inside.
Perché stiamo sentendo molta gente che è in difficoltà. Quindi tanto stare a casa continui solo a pensarci e basta. Un po' di aiuto.
The mayor, Giorgio Gori, who brought his daughters home from the UK so they could live under the lockdown in Italy because it's safer, is working 20 hours a day. He admits he's obsessed with COVID-19 data, contacting the mayors of other towns and building a picture of the actual death rate here.
There isn't any official study on this.
He's convinced the official numbers are an underestimate because too many deaths aren't being included. The number of dead may actually be higher.
Yeah.
Why is that?
In this moment, only people with heart symptoms are tested in the hospital. If you are with a high temperature in your home with cough, you are not detected. The doctor will say you stay at home, take this medicine, and if you breathe quite well, you don't need to be recovered to brought to the hospital. So you are not in the statistics. Okay, if you die in this conditions, you are out of the radar. You are not considered as died for coronavirus.
Recent figures have indicated that death and infection rates are slowing, but in reality, you'd never know. The sirens never stop.
So another ambulance passes. It's an absolute constant in the red zone. People are still being picked up, all the time. You will pass ambulances. Literally, if you stand still, an ambulance will pass you every 5 minutes. Lights on, and the driver's in full hazmat suits. It's quite astounding, actually.
There is clearly a very long way to go. Overnight, the military cleared the bodies from the hospital morgue in the town because it was full. This is the next day. The morgue is already filling up. It seems absolutely endless. Stuart Ramsey, Sky News, Bergamo, Italy.
A couple weeks ago, if I had seen that video, I would have thought to myself, that's never going to happen here. Now I am not so sure. Thank you to Stuart Ramsey from Sky News for that. That does it for me today. Ali Velshi picks up our coverage after a quick break.